Ever catch yourself a little breathless, doing something that normally wouldn't faze you? Maybe just walking up a slight hill and suddenly you're, puffing away.
Yeah, or maybe you've seen it in a pet, like your dog or cat just isn't keeping up like they used to.
Exactly. Maybe their breathing seems a bit
Oh.
strained.
Mm-hmm.
Well, today on the Deep Dive, we're looking into a condition that could be right at the heart of that left-sided congestive heart failure, L-CHF for short.
Exactly, and we've got a pretty detailed medical text here to guide us. Our goal is really to pull out the key stuff about LCHFs.
What it is, the causes,
Right, how you spot it, and the general ways it's managed. Think of it as us kind of sifting through the dense medical info.
to give you the essentials,
Yeah,
clearly and hopefully without being too overwhelming.
that's the plan. A solid overview.
So our mission is pretty straightforward then.
Yeah.
Get a good handle on what's going wrong in LCHF, what kicks it off, how it shows up, and the big picture on treatment, all based on this source.
Let's do it.
Okay, let's dive in. In simple terms, what is left-sided congestive heart failure?
Well, at its core, LCHF means the left side of the heart. It just isn't pumping blood out to the rest of the body the way it should.
Not effectively.
Not effectively, no. The source definition is pretty formal. It says the left side fails to push blood forward fast enough to meet the body's needs.
Oh, okay.
Or, and this is key, it fails to stop blood from pooling up back in the lungs.
So if that left side isn't working right, what happens immediately? Sounds like a couple of big consequences there.
Precisely. Two main things. One, the body isn't getting enough oxygen-rich blood going around.
Right, lack of supply.
And two, because that blood isn't getting pumped out properly, it starts backing up. Congesting, if you will.
Backing up into the lung.
Into the lungs, yeah.
Oof, that sounds not good. Can you walk us through that sort of domino effect?
Sure. So when the heart's pumping power is low, that's called low cardiac output, you get symptoms like feeling really tired, lethargic, not being able to handle exercise well, exercise intolerance, sometimes even fainting. The medical term is syncope.
Okay.
And interestingly, this heart problem can mess with the kidneys too. It can cause something called prerenal azotemia.
Wow, so a kidney issue linked back to the heart?
Yeah, it really shows how connected everything is, you know? A heart problem causing kidney signs, it's kind of an aha.
Mumbling.
info.
So you might see tiredness, kidney trouble,
Yeah,
and not immediately think heart.
exactly.
And what about this backup into the lungs, the congestion part?
Right. So that backup causes high pressure in the blood vessels inside the lungs.
Okay.
And that pressure forces fluid to actually leak out of the vessels and into the lung tissue itself, even into the little air sacs, the alveoli.
Where the oxygen exchange happens.
Precisely. That's pulmonary congestion. Now, the lungs have a drainage system, the lymphatics.
Like plumbing.
Kind of, yeah. But if the leaking is too much, too fast, the lymphatics just get overwhelmed.
Can't keep up.
Can't keep up. And that's when you get pulmonary edema, actual fluid buildup in the lungs. And that fluid is what makes breathing difficult.
Got it. So the heart's initial struggle kind of sends these ripple effects through the whole body.
That's a great way to put it. The source says all organ systems can be affected by poor perfusion, not enough blood flow.
Makes sense.
But it really zeroes in on the respiratory system, obviously. You see faster breathing, more effort needed to breathe.
Because of the fluid.
Because of the fluid. And, of course, the heart itself is under a huge amount of strain, too.
Okay, so that paints a picture of what LCHF is and what it does.
Right.
But why? What actually causes the left side of the heart to start failing like that?
That's the million-dollar question, isn't it? The source breaks the causes down into some helpful categories.
Okay.
First up, problems with the heart muscle itself, like the pump is just weak.
Pump failure.
Pump failure, exactly. The classic example is dilated cardiomyopathy, or DCM. The heart muscle gets weak, kind of stretched out. There are rarer causes, too, like certain infections, trypanosomiasis is mentioned, or even a reaction to a chemo drug, doxorubicin, especially in dogs. And thyroid issues can play a role, too. Both low thyroid, hypothyroidism, and high thyroid, hyperthyroidism, although high thyroid more often causes a different type of heart failure.
Interesting.
Oh, and it also mentions pacing-induced cardiomyopathy.
Pacing-induced. So that's when like a really abnormal heart rhythm, maybe needing a pacemaker or just beating super fast all the time, weakens the muscle over time.
You got it. That constant abnormal pacing wears the muscle down.
Okay, so weak muscle is one category. What's next?
Next is pressure overload. Think of the left side of the heart trying to pump blood out against way too much resistance.
Like pushing against a closed door.
Sort of, yeah. High blood pressure across the body, systemic hypertension is one cause, though apparently it's not that common in animals.
Okay.
More often, you see things like subaortic stenosis, a narrowing just below the main valve leaving the heart.
The aortic valve.
Right. Or something called coarctation of the aorta, which is rare, where the big artery itself is narrowed. It seems to happen more in Airedales, apparently. Even rare things like tumors inside the left ventricle can cause this pressure problem.
So the heart's just working way too hard to push the blood out.
Yeah.
Got it. Next category.
That would be volume overload. In this case, the left side of the heart is getting too much blood dumped into it. It's overloaded with volume.
Okay, too much coming back.
Exactly. A really common cause, especially in dogs, is mitral valve endocardiosis. That's when the mitral valve between the top and bottom left chambers gets leaky, degenerates over time.
I've heard of that one.
Yeah.
Very common in smaller dogs, right?
Pretty common, yes. Then there's mitral valve dysplasia, where the valve didn't form correctly in the first place. Can happen in cats and dogs. Other things include patent ductus arteriosus, or PDA, that's a birth defect in dogs where a fetal blood vessel stays open. Also, holes between the ventricles, ventricular septal defects, and leaky aortic valves, sometimes after an infection called endocarditis, particularly in dogs.
So, weak pump, too much pressure, too much volume. What else can go wrong?
The next bucket is impediment to filling. This is where something physically stops the left side from filling up with blood properly.
Like a blockage on the inside.
Pretty much. Things like fluid building up in the sac around the heart and squeezing it, that's pericardial effusion with tamponade.
That was serious.
It is. Or conditions where the heart muscle or the sac around it gets stiff and can't relax properly, restrictive pericarditis or cardiomyopathy.
Right.
Hypertrophic cardiomyopathy, where the muscle gets too thick. Masses inside the left atrium, like tumors or blood clots traveling to the lungs, pulmonary thromboembolism,
Wow.
and even rarer things like a narrowed mitral valve, mitral stenosis, or a funny congenital thing in cats called cord triatriatum sinister, where the left atrium is divided.
It's a lot of ways the filling can get messed up. Okay, what's the last category?
Last one is rhythm disturbances, problems with the heart's electrical system.
Arrhythmias.
Exactly. Both very slow heart rates, like a serious AV block where the signals get stuck,
Okay.
and very fast heart rates, like atrial fibrillation or sustained rapid beats from the top or bottom chambers, SVT or VT. These can eventually lead to heart failure.
And that connects back to the pacing-induced failure you mentioned earlier, right?
It does, yeah. Shows how these abnormal rhythms can damage the muscle over time.
It's a really comprehensive list of potential culprits. So when an animal is showing signs, how does a vet actually figure out if L-CHF is the problem? What clues do they look for?
Right, so the source talks about two main things. What the owner might notice at home, the history,
Okay.
and what the vet finds during the exam. Owners often report weakness, the pet being really tired, lethargic, and not handling exercise like they used to. That exercise intolerance again.
Right.
Now, in dogs, a really typical sign is coughing, often worse at night. And sometimes you see them trying to sit up or stand like they can't get comfy lying down. That's called orthopnea, difficulty breathing lying flat.
Interesting.
But here's a key difference the source points out. Cats with heart failure, they rarely cough.
Really? That's important.
Super important. If a cat owner mentions coughing, the vet's probably thinking lungs or airways first, not necessarily heart failure.
Good distinction for pet owners to know. Okay, so that's what the owner sees. What about the vet's exam?
On the exam, the vet might notice fast breathing, tachypnea, and dogs maybe hear that cough. Difficulty breathing, dyspnea is common too.
Okay.
Listening to the lungs, they might hear crackles or wheezes, signs of fluid. The gums might look pale or grayish, even bluish cyanotic, which means poor oxygen. Capillary refill time, pressing on the gums, might be slow.
Checking circulation.
Exactly. And listening to the heart itself, they might hear murmurs or extra sounds called gallops. Plus, the pulses in the legs, the femoral pulses, might feel weak.
So a whole collection of clues from the history and the physical exam.
Yeah. And of course, they need to rule out other things that could cause similar signs, right?
Sure. Differential diagnosis.
Exactly. Then come the tests. Routine blood work. Sometimes it shows mild liver enzyme changes or that kidney issue, prerenal azotemia. But often, the basic blood count, the CBC, is actually pretty normal, maybe signs of stress, but nothing dramatic.
Okay.
The source does highlight specific blood tests, though, like NT-proBNP and troponin I. These tend to be higher in animals with L-CHF.
So those are more specific markers for heart strain.
They can be very helpful, yes. Supporting evidence.
What about pictures? Imaging? I assume x-rays are pretty key here.
Absolutely. Chest x-rays radiographs are crucial. They can show if the left side of the heart looks enlarged, if the pulmonary blood vessels look bigger than normal, and critically, they can show the fluid in the lungs, the edema.
You can actually see the fluid pattern.
Yes, and the source even mentions specific patterns. Like in dogs with sudden onset, it's often in one particular lung lobe first. Cats might look patchier.
Interesting detail.
But for really looking at the heart, the structure, how it's pumping in real time, the gold standard is echocardiography.
Heart ultrasound.
Exactly. That's how you really pin down the cause. Is it a leaky valve, a birth defect, a tumor, fluid around the heart?
So the echo identifies the underlying problem.
It's key for that, yes. And the source notes that one pretty consistent finding on the echo when there's fluid in the lungs from heart failure is an enlarged left atrium, that top left chamber.
Regardless of the specific cause.
Often, yeah. Finally, there's the ECG electrocardiogram, measures electrical activity.
For arrhythmias?
Mainly for arrhythmias, yeah. It can sometimes show signs suggesting the left heart is enlarged, but the source warns the ECG can actually look totally normal, even with L-CHF.
So it's really putting all these pieces together: history, exam, blood tests, and especially the imaging.
Precisely. It's detective work.
Okay, so let's say the diagnosis is confirmed, L-CHF. What happens next? What are the treatments?
Well, the first thing, according to the source, especially if the animal is having trouble breathing, is oxygen. Immediate support.
Makes sense.
And, crucially, keeping them calm. Minimizing stress. Stress can be really dangerous in these situations, even life-threatening.
Right, don't want to add any extra strain. What about longer term?
Long-term involves lifestyle changes. Activity restriction is important, especially during flare-ups.
Taking it easy.
Exactly. And diet changes, usually moving to and if there's that fluid buildup around the heart, the pericardial effusion, draining it pericardiocentesis, is the treatment. But the success varies, depends on the exact problem.
Right. Then there are the medications. It sounds like there's quite an arsenal.
There really is. Diuretics are usually front and center.
The water pills.
The water pills, yeah, like furosemide.
Yeah.
They help the body get rid of that excess fluid, reduce the congestion, especially the fluid in the lungs.
Okay.
The source mentions specific ways to dose them, sometimes needing higher doses intravenously at first if the animal is really sick. It also mentions spironolactone, another diuretic, which is interesting because it might have added benefits for survival based on human studies. They're looking into that for dogs.
Okay, so diuretics tackle the fluid. What else? ACE inhibitors.
Yes, ACE inhibitors like enalapril or benazepril, recommended for most cases.
What do?
They help relax blood vessels, reduce strain on the heart. The source says they can improve survival and quality of life, especially in common conditions like valve disease and DCM in dogs.
Good. And then positive inotropes. I hear about Pimobendan a lot.
Yes, Pimobendan is huge in vet med for this. It's technically an inodilator.
Inodilator.
Yeah, it does two things. Helps the heart muscle pump stronger, that's the ino part, for inartropy.
Okay.
And it helps relax blood vessels, making it easier to pump. That's the dilator part.
Double action.
Exactly. It's considered a first-line drug for DCM and valve disease failure in dogs. Use in cats is a bit more debated, but sometimes used.
And there's another one, dobutamine.
Dobutamine is a powerful inotrope, but it's more for short-term critical care situations, usually given as an IV drip when the heart muscle is really weak. Need to be careful with it in cats, though potential for arrhythmias.
Got it. What about venodilators?
Venodilators, like nitroglycerin ointment, mostly relax the veins. This lowers the pressure of blood coming back to the heart, specifically the left side.
Take some load off.
Exactly. Good for quick relief in emergencies with severe lung fluid, but you usually use it on and off to stop the body getting used to it.
Right, tolerance. Oh, it feels like there's a drug for almost every part of the problem. What about controlling heart rhythm or blood pressure specifically?
Yep. Antiarrhythmic drugs are used if there are significant rhythm issues. And for blood pressure or reducing the heart's workload further, you might use arterial dilators like hydralazine or amlodipine.
Instead of ACE inhibitors
Or
sometimes.
in addition to them, yeah. Especially if ACE inhibitors aren't tolerated well or if there's kidney disease. There's also nitroprusside, a really strong one, but that's strictly ICU, short-term stuff.
Okay. What about digoxin? That's an older heart drug, isn't it?
It is. It still has a place, mainly for controlling heart rate in atrial fibrillation.
That fast, irregular rhythm.
Right. Often used with another drug, like diltiazem, for that. And sometimes still used for actual heart muscle failure, but Pimobendan has really taken over that role. Digoxin doesn't seem to improve survival much, but might reduce hospital visits.
Interesting. And you mentioned diltiazem. That's a calcium channel blocker, and beta blockers too.
Right. Diltiazem is used for rate control in some arrhythmias and also in cats with hypertrophic cardiomyopathy. Beta blockers like apenolol or metoprolol are also for rate control in various situations.
Okay.
But, and this is important, beta blockers can actually decrease how strongly the heart muscle pumps. So you have to start them really carefully, low doses, usually only once the heart failure is stable.
Tricky balance there.
Very tricky. Needs careful supervision.
And lastly, the source mentioned nutritional supplements.
Yeah, things like potassium or magnesium might be needed if levels are low, though potassium needs care alongside certain drugs. Taurine is essential for cats with DCM and sometimes helps dogs too if they're deficient. And maybe L-carnitine or coenzyme Q10 for some DCM cases, kind of extrapolating from human medicine.
So it's really a tailored cocktail of treatments, isn't it? Depending on the cause, the animal, the stage.
Absolutely. Very individualized. And ongoing monitoring is critical.
What kind of monitoring?
Regular checks on kidney function, electrolytes, hydration, breathing rate, heart rate, body weight. Checking for fluid buildup elsewhere, like the belly. Sometimes checking drug levels, like for digoxin.
Keeping a close eye on things.
Yeah.
And prevention. Can you prevent L-CHF?
Well, you can't always prevent the underlying disease, but if an animal has known heart disease, managing it carefully, minimizing stress, diet changes, maybe starting drugs like ACE inhibitors or Pimobendan before failure actually happens, might slow things down. There's research on that.
Proactive management. What are the potential bumps in the road, complications owners should know about?
The source lists things like fainting, blood clots, that's a big risk, especially in cats.
Right.
Other arrhythmias popping up, electrolyte problems, side effects from the drugs themselves, or kidney problems getting worse.
It definitely sounds like a serious condition. But you said the source ended on a slightly more positive note about outlook.
It did. The prognosis really varies depending on the cause. But it says many animals who get through that initial crisis and get consistent treatment can actually live quite comfortably for months, maybe even a year or more. Focus is on good quality of life.
That's good to hear. Okay, so let's try and wrap this up. Left-sided congestive heart failure. It's fundamentally the left heart not pumping right.
Yeah, leading to poor circulation and fluid backup in the lungs.
And we see there are tons of potential causes: weak muscle, pressure problems, volume issues, filling problems, rhythm issues.
A whole range. And the signs can differ, especially that cough difference between dogs and cats.
Right. And treatment is really multifaceted. Lifestyle, a whole suite of medications targeting different aspects of the problem.
Sometimes procedures. It's comprehensive management, not usually a cure.
Exactly. And, while this is pretty detailed stuff,
It is.
just having that basic grasp, I think, is really helpful. Whether it's for your own health or your pet's health, it helps you ask better questions, understand what the doctors or vets are saying.
Totally agree. Being informed makes a big difference in those conversations.
It really does.
Yeah.
So as you're thinking about everything we've just dug into about left-sided congestive heart failure, here's something to ponder.
Okay.
Given all those different ways the heart can fail on that left side and how it impacts, well, pretty much the whole body, what does that tell you? What does it suggest about how interconnected our bodies and our animals' bodies really are? And maybe how challenging it can be to pinpoint and manage the root cause when everything is so linked together. Definitely something to think about.